think one of the biggest myths that I see, especially when I see patients or clients in my work, is a lot of people will come into my office and assume if I have a child with a mental health concern or if our family is experiencing a mental health concern, that automatically means I either have a bad kid or I'm a bad parent. And we know that that's not true.
Children deal with so much more than what they're vocal about and sometimes allowed to be vocal about. Unfortunately, sometimes there's a saying, what happens in the house stays in the house, and that can cause a lot of stress.
When a family comes into my office, there are two things I really look for in order to determine, is there things we need to help you with? The first is this at all unusual for your development? So is it happening way more or way less than? Is it happening in a much more severe or much more frequent fashion than someone else that's in your developmental stage, right? So you look for that, is it unusual? And the second thing you look for is, does it get in the way? Is it keeping you from forming the relationships you want in your life, or being able to focus in school, or being able to get along with your family?
Well, the myth I would like parents or caregivers to know that's not true is that it's only happening to them. That it is a problem, not just in their community, not just in their state or their city, but it's a worldwide problem. And we need to deal with it locally because people feel isolated. They feel like nobody will understand what I'm going through, what we're going through. There's still a big stigma of, you don't talk to people about that. You keep that in-house.
Another myth is assuming you're gonna go lay down on a couch and they're gonna ask you, what's wrong with you? And you're gonna have to go, well, where do I start? That's not how it happens. I've yet to lay down on the couch. We sit in the chair, we talk back and forth with each other, we call each other on the phone, we video chat with each other. That's like having a best friend who you can spill all your secrets to and they can't tell anyone. And then they are medically trained, educated to provide you real life solutions with it.
I think the other myth about mental health that I would want families to know are not true is that it's going to be a lifelong problem. So that if your child is experiencing a mental health concern, that means it's going to last forever and that it can't get better. For lots of mental health problems with kids and teens, they do improve over time and eventually get to where they don't bother them at all.
I wish more kids actually came in to see a mental health therapist, because we know, for example, anxiety disorders, 1 in 4 people have them. I wish people realized how much better you could feel in such a short amount of time with the right kind of support.